Welcome to Rockin' the Ages, set in the heart of the beautiful Okanagan in British Columbia with your host, Cheryl Soleway. Life is like a game of hockey. There are fast breaks, sudden shifts, hard hits, and moments of pure exhilaration. To play well, we need more than strength. We need resilience, confidence, and a plan that's always changing for every period of the game. Rocking life at any age takes more than just push-ups, cardio, or muscle strength. It's about sharpening the mind, fueling the body, and learning how to adapt and thrive through every period. There are 7 essential keys that unlock a life of energy, joy, and purpose. Through inspiring stories, practical wisdom, and a touch of grit, Rocking the Ages is here to remind you that the later chapters of life aren't a time to slow down. They're a time to play bigger, stronger, and smarter. So lace up, lean in, and get ready to discover how to truly rock the ages. Boy, we still have so much to talk about. So let's dive into the second episode with Dr. Christine Hatfield. Let's go. Hey, Dr. Christine, now I want to move into my favorite period to talk about, which is the third period. So for those of us that are 60 years of age and older and we're through menopause, thank you. But now, again, it seems like a whole new set of, I don't want to call them issues, but I don't know what else to call it right now. Your 60 and plus patients, can you first of all tell me what you find are their most common concerns?
Well, one question they have is, can I start HRT? Because they've heard that it's too late.
Yes.
They may have read that online or been told by their primary doctor, oh, you're 60, you can't start it. And where did that come from? That came again from the Women's Health Initiative trial, where they found that older women starting HRT maybe had some unwanted effects like more stroke and blood clot. But to put that into perspective, these were much older women in their 70s, and many of them were smokers, and they already had pre-existing heart disease. This was 30 years ago, and lifestyles were different then.
Right.
There was a lot more smoking. So just to set the record straight, if a patient comes to me and she's 60 and older, and she's wanting to start HRT because she's having symptoms or because she's heard that there's protective benefits, I will say to her, yes, it's probably safe for you, but let's dig into your medical history and make sure. Do you have any history yourself or in your family of heart disease? How's your cholesterol? What's your blood pressure? If I'm at all concerned, we're going to do a little bit more testing before we just jump in with the hormones. But majority of time in a healthy woman with low risk factors, there's no danger to her starting after 60. Now, the unfortunate thing is she's already lost some ground, because the best time to start is around the time of menopause when the hormones decline, which is in your late 40s, early 50s. So she may already have lost some bone. She may already have some brain changes and things that are irreversible. But we want to slow down and prevent any more decline in function.
But also, and make her life in that period.
Make her quality of life better.
Make her quality of life better.
Maybe she'll sleep better. Maybe her mood will be better. Maybe her vagina won't hurt when she tries to have sex. Like, these are all important things that you can't dismiss.
Thank you for saying that.
Yeah.
This is my favorite part of the talk so far. I'm talking about the 60-year-olds and what we can still benefit from.
Yes, so I think that answers that question. And then what else would I tell her? I would say you want to protect your muscle and make that your new full-time job, because your muscle is going to directly impact your quality of life, your health span as you age. And there's even some evidence that it may improve your longevity. You need muscle to move around. You need muscle to be able to get up off the toilet, to be able to bend down and tie your own shoes. So if you want to be able to preserve some dignity and independence when you're older, you need to start preserving your muscle now, like I said, like it's your new full-time job.
Exactly. I am loving right now the direction of fitness. I don't know if it's this next generation that's already bringing better ideas to our generation, but again, a lot more body weight based exercise, whether it's planking, whether it's push-ups, whether it's just squats, etc. But I like the path that we're on right now. I think it's very doable at any age. So with your help and my help, we can make sure
And you
everybody's
probably
bones.
know better than I do that it's important to do it safely.
Yes,
Right? You have to
exactly.
be able to move through the movements. Your joints have to be able to
Thank
take
you.
that weight.
Yeah,
So work with someone who can help you. Don't go to the gym and just try and lift the heaviest weight you can, because you
thank you
can
for
end up
saying
hurting
that. Yeah,
yourself.
it's just so true. And again, there's such a push right now, lift heavy, lift heavy.
Mhm.
But again, in my first episode, I talked about, but if your neck doesn't have the right stability, or the right mobility in your shoulder blades, the right mobility and strength in your thoracic spine, putting that honking heavy weight in your shoulder, you're going to hurt
You're
yourself.
going to hurt yourself. And it's going to
So,
take a long time to recover because we don't heal as well as we get older. It's just a matter of fact.
so here's my next topic that I've been dying to get to, because also my seventh key is about maintenance, but that maintenance can have a fun factor as well. So yes, it's your ears, your eyes, your teeth, but also your skin, and we all want to just look as good as we feel. So I know that that's an element in your clinic. Can you tell me some of your favorite
Yeah.
strategies for, say, us third period women and men?
Sure. Well, that's the fun part of what I get to do,
I bet,
is
yeah.
helping women with their skin and giving them a bit of education. So there's a few treatments that are, I think, really helpful for women after 60. I see that the very first thing is what you're doing at home.
Okay.
That's probably about 80% of the game, is
Okay.
what you're using on your skin to help it with repair and healing and new skin turnover. So it's really easy to remember. It's A, B, C, D, zinc.
Okay.
A, B, C, D, zinc. So the A is vitamin A.
Okay.
That's your retinol products or retinoic acid.
Okay.
This is a vitamin A based compound. You don't get it from ingesting vitamin A's. When you put retinol or retinoic acid on your skin, it will have an effect to increase skin turnover.
Oh.
So it helps improve the brightness of your skin, the thickness of your skin. It looks less crepey. Um, it's it's the basic first step that you need to do.
Awesome.
Now, not
Awesome.
everyone likes using a retinoid because it can cause irritation
Yeah.
and flaking and redness. It's just part of the process that your skin needs to get used
You have
to
to
it.
ease your way
You
into
have to
it,
ease your way
right?
into it.
I'm like, if a little is good, a lot must be real good. And I
Well.
think the first time I tried it, ooh, it's pretty red there for
Yeah.
a couple of days.
It can be like that. And I've got a handful of people, I'm in that group, who I can't get to the therapeutic dose. My skin's just too sensitive, so I
Okay.
accept it. But
Okay.
most of us, if we just push through it, that flaking and redness goes
Yeah.
away. So that's
So retinol
important.
is A.
A. The
Vitamin
B
A.
is vitamin B,
Okay.
and this is nicotinamide that you're putting on your skin.
Huh.
It helps reduce inflammation.
Where do you get that?
Well, it's in good quality skincare products.
Is it really?
Like we carry in the
Nicotinamide.
clinic. Yeah.
Okay.
You can get it. You can get it anywhere skincare is sold. You should be able to find that ingredient.
Okay.
And why it's helpful, as I said, it reduces inflammation. So it's really good, especially for people who are fair, who are prone to rosacea or prone to those little broken blood vessels that
Okay.
form on the cheeks, on the
Yeah.
nose where we're sun kissed.
Yeah.
Telangiectasia is what they're called, or spider veins, we call them.
Okay.
So it can help reduce some of that redness.
Mhm.
So that's the second one. C is vitamin C.
This is easy so far.
Yeah.
Vitamin A, B, C. I like the analogies.
Putting that on your skin helps reduce pigment. Oh, so vitamin B also helps reduce pigment.
Okay.
So the sunspots and the
Right.
uneven pigment that happens from years of, not always being diligent with your sunscreen, which
Yeah.
we weren't when we were
No, we
younger
weren't.
because we didn't know.
Mm-hmm.
So vitamin C helps that, and it also helps to build collagen. And it works along with the retinol to improve the collagen production. Just makes your skin tighter, stronger.
Okay.
The D is vitamin D.
Okay.
And that we take by mouth. We
Okay.
ingest that, and it helps reduce inflammation. It helps improve your skin barrier, helps with wound healing. So vitamin D, just part of the everyday supplementation that we talked about earlier. And finally, zinc, that's your sunscreen.
Okay.
You want to have that on topically. And I choose the mineral sunscreens more than the chemical sunscreens because there's concerns about them being hormone disruptors, and
Right.
probably in very small amounts, it's not a problem. But if we're talking about wearing sunscreen every day,
And do you have an SPF must do?
30
30.
plus.
Yeah.
And remember, it doesn't mean you're good for the day. If you're going to be in the sun, you should be putting it on more than once a day.
Okay.
Yeah. Or if you're in the water, or if you've been sweating because you're exercising, remember to reapply. It's
Okay.
not a one and done kind of
Now,
thing.
how about treatments?
Yeah. So what would be my favorite treatment?
Yes. What would be your favorite treatment?
Anything that's going to help the skin build collagen.
Okay. Can I stop you there for a quick question then? I mentioned now, literally for the last 3 years, almost every single day, I do a morning cocktail, I like to call it, because it sounds sexier. But it's just a probiotic, prebiotic drink. But I've been adding bovine collagen because I was convinced that both my hamstrings, I jumped from tendonitis straight into tendinosis. So I seem to be really, struggling with that musculoskeletal and that tendinous thing. So I have found, I'm sure, that the bovine collagen, I think, has been helpful. But of course, when I talk to most women, they think that marine collagen is what they should be taking for their skin and hair. And I'm like, well, I can only take so much collagen. So help me.
I think it's marketing.
Do you?
I do. I think it's marketing to say this collagen's better than that collagen. I am not a collagen expert when
No.
it comes to the supplements. And for a little while, I wasn't even sure it was helping. But I think the evidence is there that the collagen peptides are absorbed across the gut wall and your body can use them to make collagen. But it's like Lego bricks. If I just give you a bunch of Lego bricks and lay them on the table in front
Right.
of you,
Yeah.
unless you put them together, they're just going to stay Lego bricks.
They are.
So that's the way collagen peptides work. So we need the body to be making collagen. And the sad reality is that collagen synthesis declines by about 1% per year from roughly age 25 to 30. So if you're 60 or older, you're down by 30% in your daily synthesis.
Okay.
So you're going into a collagen deficit.
Okay.
So what I recommend are treatments that are going to build collagen.
Okay.
And these are usually going to involve some type of injury to the skin, controlled injury that we do in the clinic. It can be with microneedling.
Okay.
It can be with laser. It can be with radio frequency or plasma. These are all different tools that we have that send either a mechanical or an energetic injury to the skin that the body has to heal. And then suddenly there's a burst in fibroblast activity and more collagen synthesis. And that's the best time to take your collagen drink because your body's in an active repair phase and it wants to build that collagen. So these are the types of treatments that we do. So we have Plexer, which is using plasma energy.
Sorry, say that again?
Yeah, it's called Plexer, Plexr.
Okay.
It was developed in Italy, and it uses plasma energy, which is similar to sunbursts or lightning. This is plasma energy. It's called the fourth stage of matter. And what we're doing with the plasma pen, it's a little pen. We're hovering it over the skin. The plasma spark, it's almost like a little arc. You can see like a little lightning bolt coming out of it. It touches the skin, and where it touches the skin, it changes that skin from a solid into a gas, poof, immediately. So it's great for skin laxity, helps us remove skin that's too loose for your face, and helps minimize the appearance of deep lines, especially the lines here. We call them the barcode lines. We don't call them smoker lines anymore. Barcode lines, or lines around the eyes, or redundant skin on the lid. We can remove that skin, and then the body has this healing response and builds collagen afterwards. So everything just looks a little tighter and smoother.
Can you tell me what a treatment like that would cost?
It's very dependent on the part of the face that we're treating, but when we do the eyes, we're treating the whole eye. So we're doing your upper lid, lower lid, crow's feet, both eyes. That's $1,500.
Okay.
So it's not inexpensive,
cheap,
but it's an investment in yourself, and the results, unlike some other treatments like Botox, which you're coming in for every 4 months, that's a long-lasting treatment.
Is that right?
That's going to last you years, 5 years or more. So in the grand scheme of things, it's probably less expensive than Botox.
Yeah. What are your thoughts on Botox?
Well, I think Botox is a great treatment. It's affecting the movement of the muscle under your skin. Your muscle and your skin are sandwiched together. So when you frown or raise your eyebrows, your skin moves with the muscle. When your skin gets older, it loses elasticity, it gets a little dry. Every time you crease it, for example, raising your eyebrows, I make these lines. Every time you crease it, it's like taking an old piece of cardboard and you bend it over and over, and you end up with a permanent crease.
Right.
So those lines are visible, and they can make you look tired or make you look angry when you're not.
Yeah.
And so Botox just relaxes the muscles so the movements aren't so dramatic.
Right.
It's more of a treatment as a preventative as opposed to a reversal. So if you have really deep lines, you're 60, you've never done anything, Botox probably isn't going to be the solution for you.
Right.
It can be part of the treatment process, but like I said, my favorite is to use treatments that are going to help your skin build collagen.
Okay.
So we might do laser resurfacing combined with Plexer, or we might do a series of laser skin tightening. Really depends on what are you looking for? what do you hope your outcome's going to be?
Yeah.
Do you have tolerance for downtime? Will you be okay if your
That's a
skin
good
looks a
point.
little red and angry
Right.
for a week?
Right.
Can you afford that with your work or with your social life?
Yeah.
What's your experience been before? Have you had a treatment and you didn't like it?
Yeah.
But so we have a range of treatments. So microneedling, I would say, is on the range of being relatively conservative,
Hmm.
and our laser resurfacing and plexer are ablative. So
Gee.
they're a bit more downtime, and you're going to see more dramatic results.
Nice. And you're busy. Hey, the women are coming in for
They're coming
those.
in. We can always have more.
Is that
Like, we're
right,
always
eh?
hoping people will come in.
I mean, that's pretty exciting.
I would also like to put in a plug for fillers, because dermal fillers have gotten a really bad name.
Yeah.
And it's because you can have too much of a good thing.
Right.
And I think that Hollywood went overboard, uh, overfilling women, especially the trend to have big lips. Thankfully,
Oh my goodness.
that
Yes.
trend, thankfully, is going away.
Yeah, thankfully.
But in my hands and in our clinic, we're just using fillers as a restorative tool.
Huh.
It's a gel that we're injecting. It's hyaluronic acid. That's a molecule your skin naturally makes. It's synthetically produced to be a gel, and we can put it in parts of the face where you're losing volume. And
Really?
women do lose volume. They lose volume in their temple,
Uh-huh.
their cheek, especially this marionette area.
Yeah.
And the skin, your skin, which is like an envelope around your face, doesn't fit anymore because you've lost volume. You've lost bone and muscle and fat
Yeah.
under your face. When we put the filler in properly in the areas where that's been lost, we can revolumize in a way that keeps you looking natural. And then your skin fits a little better. And then we use the lasers and the plexer and those things to improve the skin, because the skin gets a little bit like a stretched out old sweater. It loses its elasticity, and you want to make it tighter again.
I'm going to come to your clinic,
I hope
Dr.
so.
Christine. I got to book myself an appointment.
I hope so.
Well, Dr. Christine, time is flying and I've still got loads of questions left to go. I think one of the things I wanted to ask you about is the regenerative therapies out there. We're hearing quite a bit of buzz right now, especially the PRP amongst my pickleball homies. Tell me what you can about, your thoughts on regenerative therapies.
Well, regenerative medicine, I think, is maybe the new wave for anti-aging medicine. It's trying to harness the power of the body to rebuild itself.
Okay.
And it's similar to what we were talking about with stimulating collagen. That's a form of regenerative medicine when we're using lasers on the skin.
Okay.
But when we get into deeper tissues like joints and healing chronic injuries and so on, I think there's a big move to finding solutions to those issues. So PRP, platelet-rich plasma, uses your own platelets. Platelets are a part of our blood that are involved in the wound healing
Mm-hmm.
and blood clotting.
Mm-hmm.
They are tiny little fragments of cells. They're not really even real cells because they don't have a nucleus. But when they are, when you have an injury, an acute injury, platelets go to the scene of the crime, if you will,
Okay.
and they release a number of messenger molecules that will release growth hormone. I'm sorry, not growth hormone directly, but growth factors to heal and repair tissue. So in my line of work, I use PRP in conjunction with laser. I'll apply it to the skin post-laser to speed up healing and get that wound repair happening more quickly
okay.
and probably a bit
So
more
not so
collagen.
much joint care, which is that whole
Mhm.
pickleball scene. Yours is more about wound.
Wound. I also use PRP in the vagina.
Do you?
Yes.
Tell me.
Well, that I use it for two reasons. One, for women who have pain with sex, and maybe they're already on estrogen, and we're just not seeing the benefits. Well, their vagina may be lacking elasticity or blood flow, and we want to improve that. So local injections with PRP, often in
Wow.
conjunction with laser treatments in the vagina, can be very helpful at rejuvenating.
Do
Now,
I look shocked?
I know what you're thinking. Laser in my vagina. But there's two kinds of laser. There's ablative laser, which is where we're removing tissue.
Okay.
And there's non-ablative laser, which is more gentle heat.
Okay.
Both of them can have
More of
positive
a regenerative
effects.
Okay.
So I'll combine the vaginal laser with PRP, and we can also inject it in the clitoris, so it can help with sexual response, and it's lovingly called the O shot because it can help women with their sexual function.
This is interesting.
So that's how I use PRP. But I know that orthopedic doctors and doctors who do physical medicine, physiatrists and so on, are using it in joints to heal. Now, I haven't gotten into the joint space,
Yeah.
but I do utilize something called high intensity focused electromagnetic energy.
High intensity focused
Focused.
electromagnetic
Yeah,
energy.
or high fem for
That's
short.
okay.
So, where do I use high fem?
Yeah.
On skeletal muscle.
Okay.
It is very effective to induce contractions of the skeletal muscle.
So give me an example. Why would somebody
Okay.
need that?
So, the main reason I use it is to treat incontinence
Oh,
because your
okay.
whole pelvic
Sure, that
floor
makes
is
sense.
made of
Yes.
skeletal muscle.
Yeah.
That muscle gets damaged with pregnancy and childbirth, and then it
Right.
becomes weak because of the natural loss of muscle that happens as we age. So women lose pelvic floor function, and they may try Kegels on their own, or they may work
Right.
with a physio and get frustrated because they're not seeing results. If they're candidates, they can sit on my high fem chair, which is called an emsella. You sit on the chair, the magnet's in the seat of the chair, and it sends an impulse up through your pelvic floor and forces the pelvic floor to contract at a strength that exceeds what you could generate on your own.
Right. Right.
And because it's such a strong contraction, we see a response from the tissue of hyperplasia and hypertrophy, which just means the muscle gets bigger and as a result gets strong very quickly. So a woman can start to see results in 6 to 8 sessions, each of them
Wow.
30 minutes,
Right.
to help give her some control of her
Right.
pelvic floor and maybe reduce the amount of urine loss that she's
Right.
having, or maybe take away her need for pads. So we found that to be a really useful application. The other place it can be used is on the body,
Mm-hmm.
commonly on the abs as a request.
Okay. Okay.
Not so much for the aesthetic benefit, but for strength, to
Right.
improve the core strength,
Okay.
especially as a woman who's,
Mm-hmm.
I mean, I've had twins for Pete's sake.
Right.
So
It's not your fault that
your
muscle's
abdominal
been
muscles get
stretched.
overstretched,
Yeah.
so they don't come back to where they once were.
Right.
And how do you get it to contract? And I could do sit-ups all day and never get
Exactly.
strong.
Exactly.
So the device on the abs, you can also put on your quads, your hams, your glutes,
Right.
wherever you need.
Okay.
And this can be used just for people who want to build strength and to sort of build upon what they're doing in the gym. That's how
Right.
I use it.
Right.
Or for people maybe who have had prolonged bed rest because of an injury or a sickness and they've lost muscle,
Totally
or
makes sense.
simply people who are aging
Yes.
and maybe they didn't take the care to build
Right.
muscle in their 40s and 50s, and now they're 60, 70, and they wish they had more muscle. They're hearing muscle's important. We can kind of help them build muscle in the clinic. And then I encourage them to go to the gym and take this new strength and build upon
And build on it.
Build on it. So
God, I love that.
that's called M Sculpt.
Okay. I've never heard of those
Okay.
either. I'd like to just sort of finish off with, do you listen to podcasts?
I do. I'm almost always listening to a
Really?
podcast. So I like to listen when I'm brushing my teeth
I
and when
do
I'm
too.
driving the car or chopping vegetables for dinner.
Right on.
Yeah, I consider myself a lifelong learner. So I have a few favorite podcasts that I listen to that help me to know what's new in the space of anti-aging. One of my favorites is called The Drive,
The Drive.
and
Haven't
that's with
heard of it.
Dr. Peter Attia. I talk about him like he's my friend. I've never met the man, but he's originally from Toronto. He's
Uh-huh.
now based out of, I think he's in Austin, Texas. I know he's in Texas. I think it's
Okay.
Austin. He's a real advocate for science-based, evidence-based medicine.
Right.
He does what I don't like to do. He reads all the papers.
Yay. Yes.
And then
somebody's got to do it. And we love those
he
guys.
digests it and
Yep.
he presents it.
Right
And that's
on.
what I like about his work, is that he's not just telling me the latest fad. And
Right. The
he
hearsay.
he goes into it full on in the depth and looks at the research and then tells us what's right and what's not. Dr. Attia is really good, and he talks a lot about longevity, but also more about health span and how to improve the number of good years that you have. Because it's one thing to
Right.
live to be 100,
That's right.
and it's another to be a good 100.
Right.
And I don't want to live to be 100 if I'm going to be in a nursing home.
Exactly.
Yeah.
Yeah. How about, have you ever heard of Mindy Peltz? Dr.
Yes,
Mindy
I
Peltz.
have heard of her.
I like her. Yeah, I find her an easy listen to. She tends to talk to a lot of other doctors or a lot of other scientists who are doing that scientific avenues, which I know too. I'm not one to read the articles, so at least they're fun to listen to.
I like Andrew Huberman.
Yes.
I think he does a good job. He brings on
does.
some very interesting guests.
Yep. I think so many people needed to hear what you had
Mhm.
to say today. I can hardly believe we're lucky enough that here you are in our little old Vernon backyard. We're so fortunate. Dr. Christine, I cannot thank you enough. I really enjoyed hearing all that you had to say today. So thank
Well,
you.
it's certainly been my pleasure. And thank you for the work that you're doing and bringing this important information out to people.
Wow, how lucky were we to have not one but two episodes with Dr. Christine Hatfield. So typically at the end of my episodes, I like to share in my happy place, my home studio, some exercises that I think complement the video or the podcast we just did. Well, in this case, I'm literally sticking my neck out. Not my comfort zone, but I do practice diligent skincare. Two priorities that I do have. One is lymphatic drainage. I tend to carry fluid in my face, and I tend to have saggy jowls. So the other thing I'm diligent about doing is stretching the muscles and the fascia around my neck and my jawline. So here I am, sharing with you a few exercises or routines that maybe you will find helpful.
अब तू ही है किनारे लगती वो शामें अब तू ही है वो रोशनी हर दिशा में अब तू ही अब तू ही अब तू ही किनारे लगती वो शामें वो रोशनी हर दिशा में तुम तो अभी नादान हो बेकाबू नदी दिल की रुतों से अनजान हो बरखा की नमी परदेस जाके आए हवा हवा हिलाए हो बस तुम हो सोचते कि तुम भी नजदीक आ चुके हैं हम तुम छुआ छुआ जो तुमने फिर कभी अब मुझे मैं रोक कर रहूंगा वक्त ये हुआ हुआ जो खाली सफर बिन तेरे मैं शोर के कहूंगी हर्फ ये अब तू ही है किनारे लगती वो शामें अब तू ही है वो रोशनी हर दिशा में अब तू ही अब तू ही अब तू ही अब तू ही है किनारे लगती वो शामें अब तू ही है वो रोशनी हर दिशा में अब तू ही अब तू ही अब तू ही तू ही राह मुनासिर भी शुरू से तू आखिर भी तू ही खुशबू है कुदरत की तू ही हसरत है हर पल की तू ही राह मुनासिर भी शुरू से तू आखिर भी तू ही खुशबू है कुदरत की तू ही हसरत है हर पल की जमाने लगे कहने में जो बातें रह गई वो जुबां पे शर्म की सुनाने लगे जो गीत हम सर झुका के शोर में गुम गया है वक्त की छुआ छुआ जो तुमने फिर कभी अब मुझे अब तू ही